A floater is an aggregation of material in the jelly of the eye. The jelly of the eye is called the vitreous. It's the part between the front part of the eye which focuses light on the back, called the cornea and the lens, and the back being the retina. So this vitreous gel is inside the eye. Normally speaking, it's semi-solid and clear. But as we get older, it can either collapse on itself or these protein aggregates form inside it called floaters. They're called floaters because they actually move. They're suspended in the jelly of the eye, and when a patient looks at a bright light, a blue sky or a white ceiling, for example, they see these chunks of blackish material which they can make move away. They float away, suspended in this gel, and they come back, and they can be quite annoying. They're not in themselves serious, but they can disturb vision dramatically and annoy patients. The procedure of vitreolysis or vitreolysis is the breaking up, if you like, and dissolving of floaters inside the vitreous gel. Instead of a patient putting up with floaters that are suspended in their vitreous, we do something to break the vitreous up and to actually vaporize these floaters. The process of vitreolysis is actually quite easy for the patient. It's not an operation as such. It's not a surgical procedure. It's a laser procedure. Up until now, patients did benefit from a surgical procedure called a pars plana vitrectomy, and vitrectomies are still required in a small subset of patients, particularly if there's something else wrong with their eye. But for the first time, we're able to offer people a non-invasive and a relatively safe procedure to dissolve those very big floaters. The patient sits at a laser, which looks very much like one of those machines called slit lamps that ophthalmologists and optometrists use to examine a patient's eye. In fact, from a distance, it's hard for them to tell the difference. The surgeon has to find the little floater, of course, that he or she will be vitreolysing. Please understand that the floater is not static, it actually moves around. That's why it's called a floater. It's suspended in the vitreous gel, so it does move around, so sometimes it takes a few seconds for us to find it and know that we're aiming at it. And the laser beam goes in, and once it actually hits the floater, you can see the floater disappearing. You can see the floater becoming vaporized, a little gas bubble forms, and then that gas bubble lifts away and disappears. The patient perceives something happening, but certainly there's absolutely no pain. There's no pain because there are no nerves on the inside of the eye. There are no blood vessels in the jelly of the eye, and so not only doesn't the patient feel anything at all, but it's very difficult to do damage because you don't have nerves and blood vessels. The bigger the floater, the more energy is required from the laser beam to dissolve it, to vaporize it. And to be on the safe side, we do limit the amount of energy that we place into the eye. So if it happens to be a very large and chunky floater, it may be that it'll even take more than one session for us to be able to dissolve it entirely. On the other hand, if it's not particularly thick, it can still be large, but not so dense. Then we can remove that floater and another couple that may be floating with it. Please understand that sometimes it's only that one big floater, that sickle-shaped floater, or that question mark-shaped floater, or a circle that annoys the patient, in which case there's only the one floater that we need to treat anyway. The people that would benefit from vitreolysis would be those that have large floaters, floaters that even without trying interfere with their vision. Those people that have the tiny little floaters that they really need to exert some effort to see against a white background, those patients are not the sort of patients that I think would benefit from vitreolysis. Let me give you an example. I've seen patients who drive for a living. I've had a patient who was a truck driver, and he had large floaters big enough for him on occasions to think that there was an animal running across the road and causing him to swerve his truck to one side in a dangerous fashion, when in actual fact these were large floaters. So needless to say, that would be a perfect patient for vitreolysis. The probability that a patient's vision will improve is very high. particularly if the treating surgeon can see the floaters and know that they are within easy reach of the laser beam. Certainly there will be a very large proportion of patients undergoing the procedure that have a total elimination of the large floaters. But sometimes, even if we can't get rid of the floater in its entirety, we can make it so much smaller that it no longer annoys people. As a percentage, 70 or 80 or even 90% of people will no longer have a problem with the floater annoying their vision, and in the rest it'll be gone entirely. After treatment with the YAG vitreolysis system, patients can expect an almost immediate improvement in their visual symptoms. They can expect either that day or the next day, when the pupil comes down from the drops that we've used for the procedure, that their floater will either be totally absent or considerably smaller. There is no pain with the procedure, and because there's very little reaction to the laser, actually there's no inflammation whatsoever, we don't even need to give people any drops or any specific instructions after the procedure. I think this is the only procedure I perform where I don't need to give people an instruction sheet saying you shouldn't do this, you shouldn't go swimming, or you shouldn't put eye makeup on. It is that easy that they can just go home and forget that they've had the procedure done. The type of laser that we use to dissolve floaters in the procedure of vitreolysis is called an LX Ultra Q reflex laser. It's a YAG laser. Now, YAG lasers have actually been in use in ophthalmology for numerous decades. So they have an outstanding record of safety, but they've been used for other things. What's different about the Ultra Q laser that I'm pleased to say Perfect Vision Laser Correction Centres were the first to acquire is the type of energy that's used and the way it's aligned with the visual axis. It's the way we can illuminate the inside of the eye and ensure that that laser beam goes in and dissolves the floater. They've been able to rearrange the optics of the laser such that the laser goes in exactly the same axis as the surgeon sees the floaters, and it's the ability for the laser to do that that allows us now to successfully dissolve floaters inside the jelly.